Good morning, it's Your Vote Counts. I'm Scott Mitchell. You know these guys. I was looking at census information this week, and it looks like there has been a big shift in Oklahoma from the country to the city. How does that impact us?
Yeah, there was an article written this week in Free Press in Oklahoma City about this, and really what we're looking at is a big shift in the population from rural areas into suburban and urban areas. And why does this matter? I've talked to a lot of my friends out in rural Oklahoma. They're talking about their kids graduating, leaving, coming to the urban areas, and they're leaving for jobs or leaving for opportunity. But this is something I think that we can repair. We can provide opportunities, provide jobs in rural Oklahoma, but we're going to need to invest in that area. Things like access to rural broadband, making sure that rural Oklahomans have accessibility to things that we just, take for granted here in the urban areas. But it'll be an important part of making our whole state vibrant for the next 10, 20, 30 years.
Something legislative leadership and the governor are going to have to take a look at. How do you see it impacting Oklahoma?
Well, it's a symbiotic relationship. Rural Oklahoma needs urban Oklahoma to do well, and urban Oklahoma needs rural Oklahoma to do well. What we saw in the census data is people are fleeing to the suburbs, really even more than the urban core. It's the suburbs of Oklahoma City that have seen the most growth. And one of the things I really agree with my colleague, we've got to invest in things like rural broadband. We have this American Rescue Plan dollars. We need to create more opportunities in rural Oklahoma to make those communities thrive. And one of the things we need to be doing, other states are looking at it, we've got to heavily invest, work with our telecommunications companies, from our co-ops to our larger ones to AT&T, et cetera, really expand our broadband capabilities here in Oklahoma.
Broadband is a biggie. All right. There's a report this week about Oklahoma health outcomes, and as you know, they're just never good. And there's very little coverage of this week, but there was a roadmap. The bright spot was, look, we're going to have to work on diabetes, we're going to have to work on hypertension. There is a roadmap. Are we going to get on that road at some point?
So talk about American Rescue Plan dollars. Yes, they have to be spent between rural broadband and in healthcare. I talk about nurses all the time. We are a failure in American Rescue Plan dollars, to be clear. We are a failure in American Rescue Plan dollars spend if we don't invest in rural broadband and more nurses. It is a pass-fail grade. We have to get that done. Then on top of that, we got to realize there's some things we're doing in healthcare that are just not working. We need an extra focus on preventative medicine. We need to talk about how to take care of diabetes, how to take your pills. We need to have a broader discussion with the governor, whether it ends up being managed care or ends up being something else. But we've got to be willing to shift the direction we're going. And it starts with those American Rescue Plan dollars and spending them in wise ways that make lasting changes.
Yeah, just because there's an empty bed, if there's no nurse and professionals to help staff that bed, you can't do anything with it. Your thoughts on this roadmap?
Yeah, I think that health outcomes are a huge issue in the state of Oklahoma, and it's something that we have to pay attention to. It won't matter how much we spend on healthcare, and it won't matter where we provide access to it, if Oklahomans continue to do things that make their health outcomes overall bad. We had an opportunity to do this. I think if the viewers will recall that our governor was trying to push for something called managed care. This is companies that come in and specifically do things to try and make the outcome of their patients more healthy to save money. This is certainly an option for us still on the table.
Coming up our next half hour, the governor and the superintendent of public instruction, they differ.